Welcome back to the Rush Lupus Clinic and LSI educational event. We are about to start our fourth and final presentation, the panel discussion. Before we get started, I wanted to review that this event is for educational and informational purposes only and serves to benefit our mission. The Lupus Society of Illinois does not provide medical advice or recommendations. This information should not substitute or replace expert medical care. Before making changes to your medical care, consult your qualified healthcare professionals familiar with your medical condition and health status. This event is being recorded and will be archived on the Lupus Society of Illinois' website.
As everyone can see, Lashawn is back, and Lashawn is going to introduce the Rush Lupus Clinic panel. I'm going to mute myself, and I'm going to hide my camera and let you guys get on with it. But Lashawn, of course, needs no introduction. She's a lupus warrior. There's no one who does more and cares more than Lashawn, and we're very grateful for her participation today and every day. So with that, Lashawn, take it away.
Thanks, Mary. Great presentation. Before I introduce the Rush Lupus Clinic panel, I just wanted to say to the other support group leaders, Madi, Roberta, KK, Jennifer, Karen, Nancy, Maria, it really takes a village. And I know that I am not the standalone support group leader, and I just wanted to acknowledge you guys. And yes, round of applause. The work we do is truly selfless, and I could not have the successful support group that I do without the support of Dr. Jolly, Dr. Nika, and the staff, Dr. Cherny knew with me through the lupus support, through the rheumatology department lupus clinic. I am so thankful that you guys consider me a part of your extended family through the clinic, although I work in a different department. I know you, Dr. Jolly claims me as hers, I know, and thank you so much. And just thank you to this panel for recognizing that social determinants and health equity play a huge part in the outcomes for lupus patients, particularly since the majority or high percentage are minority. And I think that is something that I don't know that other providers recognize, and that is something that really stands out about Rush Lupus Clinic. So I wanted to thank you guys for that. Also, I look forward to having you guys present next year for the support groups. I'll send out some reminders, and Dr. Cherny, I'm hopeful that you will join in as well. And I look forward to meeting you in person. So without further ado, we will bring back Dr. Jolly, Dr. Cherny, and Dr. Nika. Take it away.
Thank you. Wonderful. You are definitely, Lashawn, a part of our whole endeavor. We could not survive without you. So thank you for doing that. I am guessing that we are just reading questions out of the chat.
Well, I'm happy to moderate if that's okay, and then because people are also emailing questions.
I think Mary, you should do that.
Okay, great. And I just didn't think I'd share my camera because 3 people on the screen is plenty. All right, wonderful. So I guess we do have a couple of questions, but my first question is, there've been, for so many years, there were no lupus drugs at all. And now all of a sudden we have a few more. First there was Benlysta, and then Benlysta was recently approved for kidney disease, right? Or for lupus nephritis. We have Arenia, which is a lupus nephritis drug. And then we have the new one from AstraZeneca, which is in a pill, right? So can you guys talk about how exciting that is and what that means, and kind of your expectations going forward about lupus drugs are?
I can talk about that because I recently wrote a little, little thing for your online journal about this. So it's been a very exciting year in the lupus world because there was new approvals after so long. So we know Benlysta was approved 10 years ago for lupus, and that was the first one approved after a gap of 50 years or so. So there is only a handful of drugs available for lupus. So with the addition of Benlysta about 10 years ago, that was great news for the lupus community. And it became even more available and usable when it became available in a sub-Q form. We call sub-Q when it's a self-injectable medicine. That happened a few years ago, but just recently in 2020, Benlysta was approved for lupus nephritis as well, based on a couple of trials looking specifically on Benlysta in addition to the standard of care for lupus nephritis or for kidney purposes. Besides Benlysta, which has been used successfully for many years now, there was 2 other additions in the last year, or the year that we're still currently on, basically. So the other one is called valclosporin, and it's an oral medication. It's in the form of a pill, and that is specifically used for lupus nephritis or for kidney involvement in lupus. It's a great drug. It's a new version of a class that has been used for many years. A drug called tacrolimus, some of you might be familiar with that, has been used for skin, has been used for kidneys, and valclosporin is a new version of that drug in regards to like some changes chemically that make it more user-friendly. So that's very exciting. So we have more options now into our hands. The other one is called anifrolumab, and it's an IV formulation. It's given in the office as an infusion once a month, and that's been used for all kinds of moderate lupus, like lupus activity involving like, you know, skin, joints, heart, everything, not severe lupus nephritis and not CNS lupus, like affecting the brain when you have to use like high dose steroids and all that. But for the rest of it has been proven to be very successful, and particularly about the skin. So we're very excited about this new additions in our, you know, registry of drugs available for lupus. And so, yeah, any other questions I would be happy to take about these drugs.
Okay, great. Switching gears a little bit, one question we got was vitamin C. Is there a specific dose that's recommended for lupus patients, or I know it's a great antioxidant.
So, yeah, I can field that question. So there's a couple vitamins that function as antioxidants, and I think the popularity around vitamin C actually stemmed from there was a famous scientist who was Nobel Prize winner, I think Linus Pauling. He used to recommend vitamin C for a number of different conditions. I think it became kind of there became this grassroots movement for it. I think the most common application that people use it in now is another idea of sort of boosting immunity. There's not very much high quality evidence for saying that it actually accomplishes that goal, even though it is something that is safe to take if you choose to do that in the majority of cases. In lupus, there's no specific guideline about using vitamin C to the best of my knowledge. So if someone chooses to take a vitamin C, I think most of us neither oppose nor recommend a specific dose of it. It is a water-soluble vitamin, so no matter how much you take of it, you are not going to overdose on it, if that's a concern.
Okay, what about some other vitamins that might be helpful for the immune system? Anything you recommend, like vitamin E? This question comes from Andy, pardon me.
So yeah, I can finish that thought, I guess. So vitamin E, I think it's the same sort of logic. The only difference would be an antioxidant. So just to explain the concept as well. So, you know, as a byproduct of metabolism, also as a byproduct of like our immune cells doing what they do, they release a lot of these very toxic oxygen species, versions of oxygen, which is, of course, a compound that is good for us to a small extent. So anyway, these are very reactive species, and they cause what's called oxidative damage to cells. And so that is, in theory, that can kind of damage cell components, and people have thought it can contribute to premature aging and all kinds of things like that. When it comes to antioxidants, the concept is you give something that reduces those free radical species from doing that damage. The problem is that there's really not been a lot of evidence in the majority of cases saying that if you take those things by mouth that you'll actually have that effect, and that it'll play out in some sort of a positive way. Vitamin E, I would say probably the same logic as vitamin C. Probably not opposed and probably not necessarily for it. As far as things that might be helpful in lupus, I might say many people who are on prednisone, some of the things that we will suggest in that case, and for general bone health, is calcium and vitamin D. Vitamin D is given at various doses, and you'll see some over the counter and you'll see some at prescription strengths. That's largely determined by your level, actually. And of course, in like Chicago winter, the majority of us are a little vitamin D deficient because our skin makes vitamin D in response to sun exposure. And vitamin D, one of its functions is to help us absorb calcium. So often the combination of calcium and vitamin D is recommended, and the point of it is to help supply your body with the building blocks of bone. And so it can, in theory, combat some of the bone loss that you might have from prednisone. Generally, like I said, vitamin D, the level that we give back to people is dependent on how low their level is, or if they're low at all. And then calcium, it's a little bit, there's different kind of schools of thought, but I guess I tell most people about 1,200 milligrams as long as their level in their blood is not high.
I would just add in here, Dr. Cherny covered this pretty well, that vitamin D, D as in dog, is the one that has also been raised as being associated with how active your disease may be. There is controversial literature on it that it may be associated with active disease. In addition, know that low vitamin D can cause some aches and pains also. So if your vitamin D levels are running low, replacement is important. Especially based on what your dietary intake is, do discuss it. We routinely check vitamin D at least once for our patients because in Chicago, as Dr. Cherny mentioned, vitamin D levels are low quite frequently. So there are multiple reasons to address vitamin D out of all the other vitamins. And then specific vitamin, if you're deficient on any vitamin, definitely. If you're eating a balanced meal, apart from that, I think that is good.
Okay, great, thank you. Another question from Andy. The worldwide supply chain problems have affected the pharmaceutical industry. What do you recommend if they cannot fill my Plaquenil prescription and I cannot take a generic?
Plaquenil is one of those drugs that does not have a substitute, so it's a major problem, especially during the pandemic. We ran into this problem because, you know, it was advertised as useful for the COVID treatment. And so there was shortage and we had difficulties filling it out for our patients, but there is no substitute as far as I know for Plaquenil. So you may need to talk with your doctor about perhaps considering a low dose prednisone or some other medication, depending on, you know, what lupus symptoms are active at that time, to substitute for Plaquenil in absence.
Yeah, one of the things I would raise here is that currently there is access to Plaquenil and hydroxychloroquine. Right now, we are not experiencing a shortage with our patients. We have not recently experienced that. Having said that, you would know specifically why you cannot take the generic hydroxychloroquine. We don't know that. Is this something you need to discuss with your doctors to see if it's a real issue? Is it not effective for you when you take a generic hydroxychloroquine or what? There are some patients that respond just to the trade name Plaquenil tablets rather than hydroxychloroquine, in which case the prescription from the physician can say dispense only the trade name, not generic.
Okay, yeah, Andy responded that she's just allergic to generics. So that's the reason. I've heard that before. We've gotten that question before. So I don't think it's common though, right? That people can't take generics. Yeah.
It's not common. And generally, if you are allergic to the hydroxychloroquine part of it, then you would be allergic to the trade drug also. the brand name also, but it seems like there may be some component, a vehicle or something that maybe she is allergic to, but that, you know, I have some patients where we've had to write patient does not tolerate the generic or is ineffective.
Yeah.
I see Andy's comment about not only the fillers in the generics. I don't think generalizing the generics is a good idea because they have different fillers, you know, so it's worth trying.
Yeah. Okay, great. Mari has a question. Is it true that vitamin D is a hormone and not a vitamin? She's heard that in the past.
Dr. Cherny.
Yeah, I don't know of any functions it has as a hormone. Some of the hormones that you might have heard of would be like, you know, there's the sex hormones, testosterone, and estrogen, and the majority of the component that makes things a hormone, they're fat soluble, and they tend to have a different composition, I think, than the vitamins do. Vitamin D is made of something called ergocalciferol. So, I mean, if anyone else can speak to it, I don't know, but not.
Yeah.
I don't believe it has any.
It's not a hormone. It is not a hormone, but it is regulated by a hormone. Some of the effects on your bones are regulated through a hormone, but it itself is not a hormone.
Okay, great. Then we have a question from Miranda. Along with Benlysta and Plaquenil, my rheumatologist has me on NAC and a diet that cuts out grains, legumes, dairy, limited casein A2 intake, okay, cane sugar, no more than 13 grams a day. What are your thoughts on homeopathic therapies in addition to my Plaquenil and Benlysta lupus therapies?
That's a very generic. Oh, okay. And actually, you can, Dr. Jolly.
Sure, I can address that. So, you know, there are various thoughts and programs of treatments. Allopathic treatment is where you're taking your Benlysta and medications like Plaquenil. There is homeopathic medications, which also has chemicals, but different way of delivering, but a different thought process. Then there is naturopathy, which is treatment with natural kind of products. People frequently will combine one or the other, especially with homeopathic medications. You know, the things you mentioned here about grains and dietary changes are not homeopathic treatments, but I am generally not a big supporter of combining allopathic and homeopathic medications because you may be replicating the same or reproducing the same chemical in two different forms. Also, you know, sometimes the chemicals interact in a different way and we are just not trained in knowing those kinds of interactions between homeopathic chemicals and allopathic chemicals. Now, dietary changes, diet, people are studying the role of diet in various autoimmune diseases, and the data is there about role of Mediterranean diet towards rheumatoid arthritis or in even lupus. Mediterranean diet is pretty much the only one that has been shown to have some effect in autoimmune diseases, but please look specifically into what Mediterranean diet is. It is not just pasta and wine. So please pay attention to what it is.
Wait a second. I'm sorry. It's not just pasta and wine?
Yes, it's not just pasta and wine. Because we get this quite a lot, but I'm following Mediterranean diet. The other thing is if you have other things going on like gluten sensitivity or such, then, you know, limiting those things would help you. But that is an overlap with another disorder, not just lupus by itself. The N-acetylcysteine, the NAC, you know, we are not aware of anything strong associated with this, but there are naturopaths that do believe in these kinds of things. And so I'm not in a place to comment that in yes, go ahead, do it, or no, don't do it.
Okay, great.
Yeah,
Yeah,
N-acetylcysteine, sorry, I was just going to add, N-acetylcysteine is sometimes used in medical care, but usually there's only one role that it's regularly used, and that's when someone has acute Tylenol poisoning. So if they've overdosed on Tylenol, we don't usually use it for autoimmune disease.
I know it is being studied in some research conditions, but it's not approved yet for lupus indication.
Okay. The diet question comes up a lot. People ask if there's a lupus diet. So this Mediterranean, you're not saying it's lupus specific, you're saying it's autoimmune in general, right? So there still really isn't a lupus diet.
Now, there is no lupus diet. And if you had to consider lupus diet, I would say for anyone, a well-balanced diet is the right diet. Whatever in your culture or your lifestyle fits, that is healthy and balanced, that is a good diet for you. Make sure you have enough calcium, vitamin D in there, and then, avoid any things that include herbals of the nature of echinacea and things of that nature. If you are taking any over-the-counter supplements, those are not regulated products and may have echinacea and other things that can bring about a flare. So be very careful about what supplements you're adding.
All right, great. Is there a specific vitamin D brand that should be taken?
There is no specific brand. Oh,
yeah.
okay. Mm-hmm.
No, yeah, I agree. I completely agree. I think a lot of the vitamins are actually not regulated in terms of the over-the-counter ones by FDA, which is the governing body for a number of our medications that we send via prescription, which are verified to have the quantity of what they say is in there. So I think majority of them are regulated. I think the most trustworthy body is called USP, but there's so many brands that I think that are thought to be fine under that. I don't know that I could recommend a specific one.
Right. More often, Mary, the problem is how to take calcium and vitamin D, because when you take calcium, people who are taking calcium, they're routinely horse tablets, and then they're chalky and they're huge. So people generally tend to, and lupus patients are taking so many medicines that calcium and vitamin D is the first one to drop off of their list. But also because, as I mentioned, they're not as comfortable to take. One of the things I myself take because I'm lactose intolerant is called Viactive D. And I don't have any stocks or any interests in that product, but you can try it at any of the Walgreens or Target. It comes in multiple different flavors. It has calcium and vitamin D in it. And what I do is just keep it on my dining table and in my office and take it as my dessert after a meal. And so that way I have my calcium and vitamin D all taken care of, and I can choose whatever flavor I like. I tried a couple and then got a larger box from Sam's Club or something like that.
Okay, great. Another question, how much vitamin D should we have in our bodies? Like what's the...
So we tend to consider normal or normal-ish levels as being above 30, and then somewhere in the 20 to 30 range being somewhat deficient, lower than that being pretty significantly deficient.
Okay, great. So those are the questions that, let me just check my email real quick, but I think those are the questions that we've gotten in through text. Yeah. So one thing, earlier you texted out, Dr. Jolly, about the impact tracker on us and lupus and how Rush had a hand in developing that. Do you want to talk a little bit about that tracker?
Yes, sure. So the Lupus Impact Tracker was developed at Rush. So we are involved in research, as I told you, and one of my focus is patient-reported outcomes, so that patients feel involved in their care, in their decision, and we as doctors can utilize those forms that the patients fill that are developed specifically for lupus patients to cover a whole range of symptoms and impact for patients. Because time is limited and sometimes patients would forget, oh, I did see this, or they may not be aware that this thing can also happen from lupus. So we were involved in developing a tool called Lupus Pro. PRO is patient reported outcome. And with that, GSK was sponsored us for a research, and in developing a short version of that tool that is short and sweet, that patients can complete even on the phone or in their own time, and then track how their lupus impact is. So this tool is included in Us in Lupus and is used worldwide and now being used in trials also. So use it as a journal to see how you're impacted, and it can remind you to also have your discussion with your doctors.
Okay, great. Yeah, there's some really wonderful tools on GSK's lupus site, as Aurinia's lupus site as well. Aurinia is, of course, lupus nephritis specific. All right, those are all of the questions. Is there anything any of you would like to add about just today's presentation, or?
Kira asked, Kira sent me a message, what is the name of the vitamin? I said you can get from Sam's Club. You can get it at any of the pharmaceutical, any of the places, Target, Walgreens, CVS. It's called Viactive, Viactive, and there's a D at the end of it, Viactive D. Again, I do not have any financial interests in that. That is something that works for me.
Okay, great. And there's no concern for lupus patients to try different vitamins. Like there's no, that's the over-the-counter vitamins are safe for lupus patients. Yeah, okay. All right, great. Yeah, anything that you guys would like to add, or?
Dr. Cherny?
So I would say a lot of really good information has been covered today. And fortunately, in a format where we had more time to talk about it than we might during a clinic visit. Most of this stuff is applicable to everyone who is listening in. In terms of specifics, I would definitely encourage you to bring questions to your rheumatologist to discuss about things and how they apply to you, or any residual kind of questions that you have from here. It's kind of it's a disease that affects a lot of different people different ways, and so it is good to get some individualized counseling too from your doctor.
I would add in there that I know that people say lupus is a disease of women. Men do get it, and most of the information we cover sometimes becomes very woman-centric. And I know there are men with lupus, and at Lupus Society as well as at Rush, we've done educational events centered around men with lupus. And Dr. Cherny is here. Sometimes men feel that they are comfortable discussing their health issues with another male provider. So Dr. Cherny is right here. Make an appointment. So we want to cover anyone and everyone that has lupus or lupus questions and in their care. Dr. Nika, do you have anything to add?
I was going to say it's been a wonderful morning. It's been great to be here with all of you. You learn from us, but we also learn from the patients. There is a lot of, exchange of information, and trust is something very important. So the mutual trust between the patient and the doctor is major part of decision-making, compliance. We have to be honest to each other. We have to be honest with the patient. The patient has to be honest with the compliance with medications and everything. So that mutual trust is extremely important in someone's healthcare. So just feel comfortable. If you are not comfortable with a doctor, may want to switch doctor until you find a good match so your disease is better controlled.
Yeah, and I would say there are some medications that patients may not be taking even though they've been prescribed. If that is happening or you're not taking it as it was recommended to you, you should have that level of relationship with your doctor that you can tell them, doctor, this is not a medication I would like to take or I am taking. Is there something else that works for my disease, for me, and for you? It is better to have an honest and a transparent discussion than the doctor feeling you're taking this medicine and you're frustrated and not taking it and your disease is out of control. So have that relationship and have that trust to have those kinds of discussions. So I would just say we are fortunate to have created these teams of experts and people that support us and educate us, and that includes Lupus Society of Illinois, our physicians, our support staff, and all our rheumatologists in the group. We continue to do our work, and I hope we are doing it at a level that is needed by you and that is understandable to you. Please feel free to give us feedback to us or to Lupus Society of Illinois, how we can make our events better. We always look forward to working with you.
Yes. Thank you so much.